Hi, I'm Charlie Craddock. I'm chair of the UK NCRI AML Working Party. And with my colleague Steve Napper, we're working to develop the AML20 trial. This is going to be the next intensive chemotherapy study in the UK. And I think there are three main questions that we're aiming to address. The first is working to try and optimize induction chemotherapy in fit adults with AML. And the fundamental question we're aiming to answer is whether addition of venetoclax improves the activity of CPX351, the liposomal preparation of daunorubicin and cytosine ribonucleic that has been shown to be so promising in older adults with secondary AML. And there's already a study led by the Hovon group looking at DA with or without venetoclax. And this will be the first study looking at CPX351 with or without venetoclax. The second major area that we're planning to continue to study is how do we optimize transplant outcomes in adults with AML. We know now that for many adults with AML, allogeneic transplant is the only curative option, and yet still more than 50% of patients can relapse after a transplant. So at the moment, there are two successful trials in the UK currently recruiting COSI and Amadeus. COSI asking a fundamental question about pre-transplant MRD, whether CPX351 versus intermediate dose Ara-C as the last course of chemotherapy has an impact on that and therefore might improve transplant survival. And secondly, we're examining the TBF, thiotepar-based regimen. In Amadeus, we're looking at the benefit of post-transplant maintenance. So these are three clear areas where in adults with AML who go to transplant, they're very important questions, and we want to seamlessly build into AML20. First of all, a pre-transplant MRD question to ask whether using innovative strategies to reduce MRD pre-transplant, we can improve outcome. Secondly, we're going to have a rolling program examining conditioning regimens in adults transplanted for AML. And finally, on the basis that the recruitment to Amadeus is proceeding very well, we will be exploring the possibility of using other maintenance strategies. And the final area, which is the new one, working with Professor Simon Stanworth, is to try and understand a bit more about the microbiome and outcomes in adults with AML. Simon's already doing some very important preliminary work in the PACES study to try and generate hypotheses about a favorable microbiome and potentially how we could influence that with the aim of improving survival after chemotherapy or transplant for AML. That could be by reducing the toxicity of therapy, but there's some very provocative data from the Sloan Kettering suggesting altering the microbiome might reduce relapse. And underpinning all these studies will be the very important MRD-directed treatment stratification using technologies developed by Sylvie Freeman and Richard Dillon so ably. So the major challenge for opening AML20 is the current adverse effects of COVID-19 on philanthropic funding. CRUK at the moment don't have a call. We're hoping that there will be calls in the next 12 or 18 months to allow us to deliver this trial. But I think increasingly going forward, particularly post-COVID-19 and its adverse impact on charity donations, is we need to think about partnership with pharma so that we deliver data that's of value to pharma, but also we ask intellectually rigorous and independent questions for the academic community. So we're hoping to have some more news early next year about progress with this study. And we're hoping to open the study within 12 to 18 months. Thank you.